This is Amanda Brummitt with the Capel Chambers Working Well in Capel Committee. I'm here today with Dr. Rob Lapporte, emergency medicine physician and medical director of Legacy ER and Urgent Care in Capel. Thanks for being here, Dr. Lapporte.
Thanks for having me. This is great.
Yeah, well, we know that you are super busy right now, so we especially appreciate you carving out a little bit of time to chat with us today about everything that's going on right now.
No worries. Happy to help the chamber out. They're a wonderful group that's been great to us, and love to help out with the community wherever we can.
Oh, thank you. So I'm going to ask you some general questions about things that I've been hearing around town about coronavirus. And the first is, what can people do to prevent acquiring and spreading coronavirus?
Great question. So one of the things you'd want to do to be really careful about preventing it would be hand washing and hand sanitizing. So we always recommend that during flu season, of course, or viral season, but this is exponentially worse, as everyone's aware. So I would say carry hand sanitizer with you all the time. Be really careful when you're outside your home. I would wear a mask everywhere you go. I mean, unless you're in the middle of an open field doing jogging or something like that. But when you're at the grocery store, I would have a mask on the whole time, and use the hand sanitizer. Be really careful about touching your face. The reason I bring that up is because it's kind of habitual. I think we all do it, multiple times per hour without thinking twice about it. You rub your nose, or you rub your eyes when you're tired, or you pick that little piece of spinach out of your tooth, or what have you. And so you really want to be careful about that. If you do need to touch your face for any reason, I would just make sure you sanitize first and really make it a conscious decision. And it's a hard habit to break. And then, of course, social distancing, as you've heard about on the news. There's this magic number, 6 feet, that they keep throwing around. I would personally say that's a bare minimum. Things I've read about things like coughs and sneezes, they can travel a lot further and linger in the air for quite a while. So I would, try to keep that distance as large as possible. Yeah, those are, I would say, the big ones: the avoiding touching the face, the hand washing, the sanitizing, masks. Those are the kind of the big things to help prevent it.
Okay, great. And then I'm seeing things all over the place. Everybody is an expert and a doctor these days when it comes to this. So tell us what doesn't work to prevent coronavirus, what people are doing and they shouldn't be wasting their time or resources on.
What doesn't work? I would say using gloves all over town. This kind of cracks me up because, unless it serves as a reminder to you to avoid touching your face, because maybe you'd be more cognizant of it. But when you're touching, your grocery cart, and then you're touching an apple, and then you're touching, it's still, whether it's your hands or a glove that's been in 10 different places. So I would say that's probably the biggest one. I don't want people to get this false notion that they're somehow unable to spread the virus because they have gloves on. Mm-hmm. I think that's probably the biggest one I can think of when I think of things that don't work. Obviously things that are still helpful is if you have to cough or sneeze, you do it into your, arm and all that, but it's not certainly guaranteed. There's still some misting about when you do that, and that's why I express to everybody that those masks are so important, because that person that's next to you that may choose to sneeze into their arm, while it's the best practice for them to do, it doesn't guarantee that you're not going to be exposed. Don't be lulled into a sense of comfort that somebody else is being cautious, because you can still get it.
Right, makes sense. Okay, and then for someone that thinks they have contracted COVID-19, when should they seek treatment?
Now, as soon as possible. I don't think it's worth delaying. I think it's really helpful to know if you have it. If you're having the symptoms, getting confirmatory testing can be really helpful. Mm-hmm. If you think you have symptoms, I would either, depending on where you live, come into a place like ours, go to a hospital, call your primary, whatever you feel is safe. If you are markedly short of breath, then I would say call 911 or go to the hospital. But I think it's worth getting evaluated if you think you're having symptoms.
Okay. And then you mentioned some different treatment options. Is there one that you recommend over the other, or
Obviously, I'm a little biased. We are certainly very capable of handling these types of cases here at Legacy. So we have more and more testing available, which is fantastic, and we go out of our way to really be careful to avoid the potential of spreading of it. So, for instance, we are evaluating patients outside in the parking lot in the ambulance bay that we think might have COVID symptoms to avoid bringing them in. And so that allows less likelihood of passing the illness. If anybody does have to come in, whether it's COVID related or for an ankle sprain, we put everybody in a mask. Roughly about 25% of people who have COVID end up not having symptoms. So we just treat everybody who comes in off the street like they have it. We just figure that's the safest way to do it. So of course, we welcome anybody to come into our facility, but as I mentioned, it's not always appropriate for every patient. And if somebody is having like a lot of trouble breathing, then I would recommend that they call 911 or go to the hospital. If they have a good relationship with their primary care doctor, we certainly, don't ever want to dissuade anybody from calling their primary. And there's a lot of great primaries in this town. And so we would always encourage you to call your primary too and take their advice on how to get seen if they're still seeing people physically or if they're doing telemedicine or what have you. But there's some great relationships here, and we always encourage our patients to keep tight relationships with their primaries.
Yeah, that's actually really, really good information. I had previously read, and most of what we've seen on the news, I think, was to stay home if you think you have it, because of the lack of testing. But that's really exciting to know that here in Coppell that we have tests, and if you think you have it, you can come in and get tested and start.
Yeah, we're getting more tests all the time. In the beginning, I'll be the first to admit, we were a little nervous because of the lack of availability of tests as well as PPE, personal protective equipment. And so, but now we are very well stocked with PPE, partially due to availability locally where we can place orders and purchase it. Mm-hmm. And to be honest, there have been so many businesses locally, schools, Lowe's, Home Depot, like multiple businesses that have donated N95s to us and eye shields and all sorts of wonderful things. So we're super appreciative of that, and it's helped us serve our patients better and keep us better protected. So I think what was true a few weeks ago, where other people and we were saying, it might be best to stay at home because we meaning the entire country, isn't really ready for this. But we, the country, and we at Legacy are certainly more very prepared for this now. And so I think the message is different now. So definitely come on in, get evaluated. The other thing is a couple more things I'd mention. Sure. It can be a little, this illness people can get worse pretty rapidly. Mm-hmm. And so one of the benefits of coming in to get evaluated versus staying at home is that we can check your oxygen level. And sometimes that can be an early warning sign, like, hey, you don't even feel short of breath maybe, but your oxygen's getting low. Might want to get a chest x-ray on you. And sometimes the chest x-rays look worse than people feel, and vice versa. Mm-hmm. And so we have definitely had cases where the chest x-rays have given us valuable information and help us determine who might need admission, even if they don't feel horrible at that moment, or just kind of makes them a little more alert, like, hey, we think you have it and your symptoms are getting a little more serious. I would have a low threshold to go to the hospital if this gets, even the slightest bit worse. And
you have that right there in your facility, right? So it's not like they come in, see you, go get an x-ray and get called later. They get that right then at the point of care?
Yeah, that's exactly right. As a matter of fact, unless they're like markedly short of breath and have to come in for that type of treatment. But if somebody comes in with like cough and COVID-like symptoms, they would be evaluated outside by their in their car or by their car. And then if they wanted to get a chest x-ray, if we recommended it and they accepted it, they would get a mask, go in, get an x-ray, and go right back out to the car while we're waiting for the radiologist to read it or while we are interpreting it. So again, we try to maximize efficiency of not only time, but it's most importantly of safety for both the patient and the staff.
Right. That's fantastic. All right. Well, anything else that you would share or leave our followers with?
No, let's see. I would say, oh, here's one more thing. Yeah. One of the things that we're noticing is that because people have been told to stay at home,
Mm-hmm.
they end up coming in sicker than they would have before, and whether it's COVID related or not. So let's say somebody has a stomach ache. If they're following the advice of what's being said in the media or what people told them 2 weeks ago, 3 weeks ago, to stay home as long as possible, instead of coming in very early and getting diagnosed maybe with early appendicitis or something like that, they end up coming in later and having a more severe illness.
Right.
And so we're seeing that people who come in for even unrelated things, not related to COVID at all, end up sicker. And we just don't want to see that happening. So we just want to reassure everybody that they are safe to come here. We have taken every precaution. We've now had time to acquire PPE to kind of get the system down. We are no longer in, like crisis mode, like the whole country was. We've got the system down now, and I'm very confident that one would be at higher risk for avoiding to come in for fear of risk of getting it here than the chance of having your illness get worse by staying at home. So that's the big one. And of course, like we talked about earlier, prevention is really the key. So while I do say come in here, we're safe, all that, if you are sick, try to avoid getting sick in the first place by using all those things we mentioned earlier about the masks and the social distancing, and the hand washing and touching of the face and all that. That's really key.
Okay. Well, that is all really great advice. And again, I know how crazy it is for you guys right now. So thank you so much for taking the time to share some of this information with us. And again, everybody, this is Dr. Rob Lapporte with Legacy ER and Urgent Care in Coppell, helping keep us healthy so that we can all work well in Coppell.
Thanks. And if anybody has any questions, we have, the Legacy, they could post questions on our Facebook, on our Legacy, or there's the Facebook Coppell group that has like 9,000 members, I think now. And sometimes when somebody tags me, or if I just happen to see it, I'll chime in and answer whatever questions I have. Sometimes people do ask questions about Legacy or about healthcare in general, and I try to chime in where I do notice it, but feel free to reach out to me. Always happy to help. This community has been amazing to me personally, to us at Legacy, and I like to give back in any way I can.
Thank you. Thank you very much.
And thank you, and thank the Chamber very much. We appreciate you